What's up? We'll get started in a minute. How's everybody doing today? Hey, if you haven't already, follow us also at No Filter DC on Instagram and Twitter. See, we have our team joining. Let's give a little bit more time and we'll jump into the topic. So today I will be talking about the pandemic. I know you're probably tired of it, I know, but today we're going to actually look at the pandemic through the lens of how it has impacted LGBTQ people specifically. So that's today's topic. My name is David Wilson. My pronouns are he, him, his. I am a Whitman-Walker influencer, a part of the community health team. I come on here usually on Tuesdays, but sometimes other days to talk about, STIs, sexual health, social determinants of health, mental health, a lot of different topics we cover here. So continue to tune in and I'll be here. So again, today I'm going to be discussing COVID-19, but specifically how it has impacted the LGBTQ plus community. So COVID-19, we all know it took the world by surprise, right? Like hundreds of thousands of folks have contracted the virus and every community has been affected. But, LGBTQ folks in the U.S. have faced some very unique challenges compared to their cisgender straight counterparts. So a CDC report that was released back in February found that gay, lesbian, and bisexual people in the United States have higher rates of self-reported underlying conditions associated with COVID-19 outcomes. That includes like asthma, cancer, heart disease, obesity, kidney disease, and stroke more than their heterosexual counterparts. So within the LGBT community, actually Black and Hispanic folk are particularly vulnerable according to that report. In addition, 14 million LGBTQ adults and about 2 million LGBTQ youth in the United States are impacted. More than 5 million of those folks actually work in jobs that have been impacted by COVID-19. This includes working in like restaurants, food service, hospitals, K through 12, education, higher education, and retail industries. So just as I mentioned, LGBTQ people work in highly affected industries. So some of the top 5 industries that are known to have a higher, impact on LGBTQ folks are, the restaurants and food service industry. About 2 million LGBTQ people work in restaurants and food service. About 1 million actually work in hospitals. About another 1 million work as K through 12 in K through 12 education. Almost 1 million of those 1 million of LGBTQ folk work in universities. About 500,000 actually work in retail. So all of these industries have been severely impacted by the pandemic. A lot of these businesses closed, and that's more than 5 million LGBTQ workers that have been impacted by the pandemic. Also, there are so many other variables that impact specifically LGBTQ people. So for example, LGBTQ people have less wealth. Nearly 1 in 10 LGBTQ people are unemployed or are either more likely to live in poverty in relation to their straight and cisgender counterparts. That means that LGBTQ people cannot always afford health care that they need or afford to pay for the preventative health care that they might need. About 1 in 5 LGBTQ adults in the United States, that's about 22% of the LGBT population, live in poverty. That is compared to about 16% of straight folks who live in poverty rate. So the LGBTQ poverty rate is, literally like 8% higher than it is in straight communities. And also, in particular, transgender adults are and cisgender bisexual women are more likely to be or have a higher rate of poverty than, other groups. Particularly for Black and Latinx folks, specifically the transgender population, they're more likely to live in poverty than, transgender folks of any other race. So Black and Latinx transgender folks are more likely to live in poverty than, let's say, white folks or Asian transgender folks. To make matters even worse, Black LGBTQ and Latinx LGBTQ folks are most likely to have avoided going to the doctor because of, cost. So, these folks are disproportionately impacted by COVID-19 and all these things. You kind of see these in the statistics that I'm reporting here. As I mentioned earlier, healthcare. There's obviously a healthcare gap between LGBTQ folks and, straight folks. So being able to afford and access medical care is essential for testing for COVID-19, right? As well as treating the symptoms of the disease. However, LGBTQ people are more likely than their non-LGBTQ peers to lack health coverage and the monetary resources to actually visit a doctor, even when it's medically necessary. So this is a very sad social determinant, and it can lead to an avoidance of medical care even when it is required, whether that be pandemic related, COVID-19 related, or some other type of health related. LGBTQ people are also more likely to experience a severe economic hardship when medical care is assessed. And that's probably because there are more LGBTQ folks who don't have health care coverage than their straight counterparts. There are still so many other variables that we could talk about that disproportionately impact the LGBTQ community, specifically economics. So let's talk about economics. Like a larger share of LGBTQ folks compared to their non-LGBTQ counterparts, and these are adults we're talking about, report that they're worried about someone in their household experiencing or being affected by COVID-19 job loss. That brings the LGBT population to 56% versus their straight counterparts at 44%. So that's another disproportionate statistic. Mental health is another variable. So 3/4%, about 75% of LGBTQ people say they worry and stress about the pandemic and that it has had a negative impact on their mental health. Now, that is compared to 49% of people who are not LGBTQ. So that's another disproportionate statistic. Also, about 34% of LGBTQ adults have think that the news has underestimated the severity of the pandemic versus, 23% of non-LGBTQ people who believe that, the news have reported, the impact of the pandemic appropriately. About 3/4 are very worried or either somewhat worried that, someone in their family will get sick. So I mentioned that earlier, but the key fact here is that only 67% of non-LGBTQ, folk have that sort of worry. Lastly, it's like vaccinations, right? Like, while LGBTQ people report wanting to get vaccinated at a similar pace as, non-LGBTQ folks, a greater share of LGBTQ adults are doing so as part of everybody's responsibility to protect the health of our community, right? So about 75% of LGBTQ folks have received at least one vaccination, compared to about 48% of non-LGBTQ folks that have received one dose of the vaccination. So it is no surprise that non-LGBTQ people see vaccination as a personal choice, not a community choice. LGBTQ folks are more likely to think it's a community effort to be vaccinated. And so now, since we're on the topic of vaccines, if you don't know, anyone over the age of 12 and older are now allowed to get the vaccines in all states across the U.S. That includes in any state. And if you are looking to get vaccinated and you need to find a location near you, you can actually visit vaccines.dc.gov. And you put in your zip code or your address, and they'll help you locate a vaccination site near you. You can also call us at Whitman-Walker Health, and we are vaccinating or setting vaccination appointments at Whitman-Walker Health as well. I do want to remind you all, and I pinned that at the bottom, that we are still open for HIV and STI testing. It is by appointment only at our Liz location and our Max Robinson Center location. Liz location is located on the northwest side of DC, and the Max Robinson Center is located on the southeast side of DC. And you can either call us at 202-797-4439, or you can email us at appointments at whitmanwalker.org. And it's pinned down here in the comments so that you can see it if you need it. Before I close today, I do want to remind everybody that it's important to get vaccinated. Like I've already said that, I'll say it every day, say it every time I get on here, but let's go out and get vaccinated. It's really our only way to like really slow down the infection rates with COVID-19. And with the news of this potential variant, you want to make sure like you get vaccinated. That'll actually slow down that variant. And if you go to the CDC website, there's research and stuff about that as well. Now, if you want to get vaccinated and you have not, I mentioned you can go to a DC walk-up site, or you can email us at Whitman Walker Health, or call us at 202-207-2480, and we'll get you an appointment for that vaccine. Now, if you already got vaccinated, I want to say thank you personally, but from the community, we want to thank you that you've gotten vaccinated. Most importantly, now you can relax your mask wearing. And so that's one of the benefits of getting vaccinated. Now, we all understand there is no true way to really like determine, who's vaccinated and who's not vaccinated. So if you want to continue to wear your mask in order to keep the community safe and keep yourself safe, then continue to do that, because there are no real protocols to tell who has received a vaccination or not outside of having that vaccine card. Now, if you haven't been vaccinated, please go get vaccinated. You have to continue to do your mask wearing and your social distancing and take all the precautionary measures that have been recommended by the CDC. Keep your distance, do all that stuff. But most importantly, go out and get vaccinated. It's really up to all of us to stop the spread of COVID-19. And in order to do that, we all got to, get at least one dose of the vaccine. Come on, let's shoot for one dose. I definitely encourage you to get 2 doses of the, Moderna or the Pfizer. But at least it's scientifically proven that 1 dose will still reduce the impact of that, the potential death from COVID-19. Most importantly, continue to follow us. I will continue to share information here. You can follow us on Twitter, Facebook, Instagram at Whitman-Walker. You can also follow us at Real Talk DC. You can follow us our The Corner, which we do art exhibits and all those cool things at The Corner on Facebook, Twitter, Instagram. I'll see you all next week. Thank you.